This video was brought to you by Hamilton Madison House, AAF, and ONA.
COVID-19 has strongly impacted our communities. Even though we are not seeing as many cases as in March or April, we are still in a pandemic and must be careful.
One person can spread COVID to multiple people. A single sneeze can produce up to 10,000 droplets, and a single cough can produce up to 3,000 droplets. This allows the virus to become airborne, and it can stay within the air for hours. On average, one COVID patient infects at least 2 to 3 more people. This means that one COVID case can quickly become many COVID cases. We cannot control the spread of COVID-19 unless everyone does their part. Make sure you wash your hands often for at least 20 seconds, wear a mask and cover your mouth and your nose, maintain social distance whenever possible, avoid indoor gatherings. This helps protect you, your family, and others who are more vulnerable to the virus. Help save a life today and every day. COVID impacts each person differently. Some people have very severe cases and need to go to the hospital, while others don't even know that they have COVID. Symptomatic people feel sick and experience symptoms such as fever, cough, or shortness of breath that tells them that they have the virus. Asymptomatic people don't have any symptoms and can live life normally, not knowing that they have the virus. Even though asymptomatic people don't look or feel sick, they can still pass the virus to other people. The people they infect may not be asymptomatic and can develop serious COVID cases. It is important for us to follow the health guideline to protect ourselves, our families, our friends, and the community. The only way to know for sure if you have COVID-19 or not is to get tested. If you do experience symptoms of COVID-19 or think that you may have been exposed to the virus, it is important that you get tested. Individuals who test positive for the virus can appear symptomatic or asymptomatic. Until you can get tested, make sure to quarantine to keep others from getting sick and to help keep the virus from spreading. If you test positive for COVID, do not leave your house and isolate yourself from other people you live with who do not have COVID. Maintain physical distance from others until your symptoms are gone and you receive a negative test result. Free testing is available to everyone, including immigrants and people who have no insurance. There are many COVID testing sites around New York. Some places do not need an appointment or referral, while others require an appointment. Some centers give you results the same day, while some takes a few days to send you the result. CityMD, through partnership with the New York City government, offered testing at all its New York City sites on a walk-on basis, 7 days per week. And the New York City Mayor's Office of Immigrant Affairs has resources and important information regarding COVID-19 on their website available in multiple languages. There are also frequently asked question sections that can help provide the answers you're looking for. Getting care, treatment, or testing for COVID-19 will not make you a public charge or hurt your ability to apply for a green card or citizenship. Please seek care without fear. There are strong privacy protection in place for all healthcare patients, regardless of immigration status. The most important thing to remember is that if you feel sick or think you need to get tested, everyone has the right to get a free COVID test. New York City health guidelines are always changing based on the numbers of COVID infections and hospitalizations in the city. As case increases, things such as schools, gyms, indoor dining, etc. may be closed. And the number of people allowed at indoor or outdoor gathering may also change. This also may impact travel or quarantine requirements. To get up-to-date information, visit coronavirus.health.ny.gov or call the COVID-19 hotline at 1-888-364-3065. You can also receive text message updates by texting COVID to 692-692. You can also download the free COVID Alerts in New York app on your smartphone. Remember, COVID can spread from person to person, whether they have symptoms or not. Among patients, the risk of severe illnesses from COVID-19 increases with age or with other health conditions like diabetes, heart disease, asthma, etc. It is up to all of us to control the spread of COVID. Be responsible and wear a mask. If you have any symptoms, even what seems like a common cold, get tested because it could be COVID-19. By getting tested when needed and following health guidelines, we can create a safer community together and save lives.